What's wrong?
I fell out of a tree.
Oh my gosh, we need to get you to the hospital, but you have to tell me, what do you feel like? What's going wrong?
I feel like they're broken.
Oh my gosh, do they feel like they're hurting?
Yes.
Oh my gosh. Oh, honey. We're in the hospital.
Hi, it's Aubrey.
Healthcare provider?
I'm your doctor today. Hi. Okay, so could you please verify your name and date of birth for me, please?
Ava Makashima, March 16th, 1991.
All right, and so what brings you in today?
I fell out of a tree,
Okay, and how high up were you?
10 feet.
Where were you?
I was at school,
Okay, where did you go to school?
CSU Stan.
CSU Stan, okay. My daughter goes there. Maybe you know her. So who do you have here with you today?
My mother,
Okay.
for
hello.
emotional support.
Okay.
Hi, nice meeting you.
Nice to meet you too. So could you tell me the symptoms that you're feeling from your fall?
Intense pain. I'm having a hard time getting around. Yeah, that's about it.
Okay. I'm gonna ask you some questions about your history, your medical history. So
Okay.
do you have any history of seizures?
Yes.
Yes. All right. Do you have any history of glaucoma?
Yes.
Yeah. Okay. What about inflammatory bowel disease? Do you have that?
Definitely.
Definitely. Okay. Definitely. Okay. Are you nauseous very often?
Always.
Do you feel like throwing up a lot?
All the time. Especially in class.
Okay. Do you feel like that right now?
Yeah.
Okay. When's the last time you vomited?
5 minutes ago.
So, do you ever experience PTSD? Are you familiar with that?
Are you familiar with my background?
Yes, I see in your chart here, but I just thought I'd ask you personally.
Yes.
Yes, of course. Okay, so anxiety, you experience this as well, I see.
Mm-hmm.
Could you tell me how often you experience your anxiety?
Only every day.
Okay, every day? How about right now?
Yeah.
Yeah, okay. So, continuing forward, do you have any trouble sleeping?
Yes.
Sleeping at night?
Mm-hmm.
Okay, sleeping during the day?
Mm-hmm.
What about in the afternoon?
I never sleep.
Okay. My last question to you, do you have trouble getting an appetite?
Yes.
Yes?
Food's repulsive.
Okay, it's repulsive. Never wants to eat. Okay, so I'm going to refer you to one of our specialists on our team here.
Okay.
It's our marijuana specialist.
Okay.
Alright. Hello. I am here.
Can I?
I hear you're here
We all
because you're considering the use of a complementary and alternative medicine. That being cannabis.
So boom, that's that weed plant.
There are a couple things you gotta know first.
Just in case you don't know how to spell, it's cannabis. But she also goes by, you know what I'm saying? Like Spider-Man, Mary Jane! Or AKA green crack. Or under here you wanna, you know what I'm saying? Right? Stress relief. I don't know how you spell reliever. Help me out. How you spell reliever? I don't do it no more.
First, you gotta look and make sure you get the right screening tests done. Those screening tests can include getting an accurate medical history, which although further includes a physical examination, some psychiatric assessments, just to make sure we have all the underlying conditions and causations that might be under there taken care of by our local physician.
You under stiggity?
Next, you want to make sure there is extra counseling and education available to all patients engaging in this alternative medication. Finally, there are some fuddy-duds in our legal system, and so you ought to make sure we're following all the local laws and regulations pertaining to the drug of cannabis or medical marijuana. Now, when we're using those things, we want to make sure we have accurate understandings of contraindications. So, if you're thinking about engaging in the use of medical marijuana, please make sure all pregnant women and babies avoid all understanding and use of medical marijuana. The effects of infants and pregnant women are not understood and therefore should be avoided. Please avoid medical marijuana if you have a history of substance abuse or psychiatric disorders. Respiratory issues, kidney or liver issues, as metabolism and elimination of some aspects of medical marijuana occur in those organs. And make sure you want to avoid it with any cases of allergies or young age. We don't want any children using this drug. Marijuana with sedatives or depressants, be careful and to make sure to watch out because there could be a use for extra respiratory depression in cases in those patients. Also in the same way, make sure to use caution when exercising medical marijuana with blood thinners for those same reasons. Although medical marijuana may be useful for chronic pain, anxiety, or PTSD, it can also be useful for managing the pain of other more serious conditions, such as cancer, HIV, AIDS, or IBD.
Back problems, like, oh, my arm hurts, weed.
So before you consider any use of such alternative medications, make sure to have a complete and total consultation with your local healthcare provider.
Dr. Caleb Heinrichson.
So small. All right.
We don't know exactly how cannabis sativa works, but we know that THC is the primary psychoactive ingredient of cannabis sativa, as well as marijuana, which is a derivative of cannabis sativa. THC is the psychoactive ingredient, it is the ingredient that treats the diseases because it increases the dopamine.
Did you know that medical marijuana is actually used for patients that have Parkinson's disease?
Yeah. Increases dopamine.
See, that's my student right there.
And relieves your pain and may help with muscle spasms even because of lack of dopamine. Anything that has a lack of dopamine, THC can help with. But we have some warnings. Over time, these CB1 and CB2 receptors can get used to having THC in their system if you use it too much, right?
Weed is an addiction.
So your normal neurotransmitter will have no effect on the CB1 and CB2 receptors at some point. It becomes desensitized to that and expects THC. So you may be very unhappy after using marijuana for a long time.
So you feel me? You know what I'm saying?
Another problem with CB1 and CB2 receptors is that they're also found in the cerebellum, which has nothing to do with dopamine. The cerebellum, effects in the cerebellum may give you...
It's the human brain, here we go with this. Oh.
It may give you distortions, and vision.
Weed, paranoia, schizophrenia.
Vision problems. So those are a couple of things to watch out for if you think someone is using too much marijuana.
What is that?
Hi, my name is Princess, and I'm going to be talking about the proper use of marijuana and the education behind it. Marijuana is the most commonly used in the United States to help with pain. And there's a few tips that are useful when you are consuming marijuana, which is weed. Make sure that your meds, and if you have a certain health condition, that you don't mix it with marijuana, but it's best to get clarification from your primary care provider to make sure that you're able to do that. It's best to read dosing labels and start off small so you know how much you can handle. And you have to know when you've had too much. Don't mix weed with any other substances, and if you are high, which it will make you high, make sure you just don't drive. Okay, so a question that's always asked is if medical marijuana is legal in the United States. The U.S. federal law prohibits the use of whole plant cannabis sativa or its derivatives for any purpose. So many states allow THC to be used for medical conditions, federal law regulating marijuana, state laws. Because of this, people may be arrested and charged with possession even in states when marijuana is even legal. U.S. federal law prohibits the use of marijuana. However, many states allow medical use to treat pain, nausea, and other symptoms that they may have. Question that might be asked is, when is medical marijuana appropriate to be used? Depending on the state, you may qualify for treatment with medical marijuana if you have certain requirements and have a qualifying condition like Alzheimer's, ALS, HIV/AIDS, Crohn's disease, epilepsy, seizures, glaucoma, multiple sclerosis, muscle spasms, severe and chronic pain, severe nausea or vomiting that is caused by cancer, or not cancer, but the treatment in relation to cancer. There's different types of marijuana, which they could be in a variety of different forms, which could be a pill, liquid, oil, powder, and or dried leaves.
Hey guys, so I was pretty stressed out, so I decided to drop out of school, and now I just smoke weed all the time, and life hasn't been better. This is probably the happiest I've ever been in my life. That's all I gotta do?
Yeah. Like a purple way.
Okay.
What am I supposed to respond with?
Oh, you were.
Maybe you guys should.
Wait!
You already looked at the folder.
Wait, stepmom.
Oh! Matter of fact, you know what? Don't even call me your mom. I don't care about you. Better go talk to your daddy.
Zoom in on her eyes.
Boom!
She's gonna add. You fell out of a tree.
Oh my gosh. How high up were you?
80 feet.
How high up were you?
10 feet.
10 feet.
Miracle, she's alive.
It's a miracle. Do you have a history of seizures?
No.
Say yes.
Oh.
Start over.
Sorry, yeah.
I don't know. No, I don't. I literally don't know where to go. Is what I'm having a problem with. What was that?
Can you identify yourself?
She took off her dog in front of me. She was
No, you
did. I don't know where to start.
Unhappy after using marijuana for a long time.
Ow! I just put my fingers in the door.
Oh, I'm sorry I left. I thought you were
I'm so
still
sorry.
there.
No, I didn't interrupt the light.
Whose dog is that?
Sometimes you got a little ugh. That part be scaring me because it be like, it's purple, so it's like, what's it gonna do? Okay, so I keep going? Yeah. It goes to your neurology system. Oh. You feel me under stiggity?
You have a complete and total consultation with your local healthcare provider.
Yeah.